So good day everyone. We are the group 4 and our topic today will be the women's health and maternity care. So for our introduction, next slide please. For our introduction, women's health and maternity care encompasses a broad range of health services and support systems designed to address the unique health needs of a woman throughout their lives. With a particular focus on reproductive and maternal health, this is a comprehensive care model aims to ensure women receive the necessary medical attention, guidance, and support during preconception, pregnancy, childbirth, and postpartum period. So next slide, please. Here are the critical aspects and components. We have the preconception, care, and childbirth care. For the preconception care, we have the health assessment, evaluating a woman's health status, including chronic conditions, genetic factors, and lifestyle choices that could affect pregnancy outcomes. The counseling and education, providing information on nutrition, folic acid supplementation, and cessation of harmful habits such as smoking, alcohol consumption, and managing chronic health condition. For prenatal care, we have our regular checkups scheduled for visit, monitor the health of the mother and the developing fetus, assessing risk factors and detecting any potential complications in early stages. We have our nutritional support, guiding on balanced diet and necessary supplements to support pregnancy on specific conditions. The screening test to screen for genetic conditions, gestational diabetes, and other one on one counseling. For education, preparation for childbirth, breastfeeding, and parenting through case or one counseling. For the childbirth, labor and delivery support, medical and emotional support during labor and delivery, including pain management options and monitoring for complications. For birthing options, support for various birthing plans and environments such as hospital births, birthing centers, and home births, respecting the woman's preference and medical needs. So, next slide. Here are the continuation. We have our postpartum care. This is we have the physical recovery, monitoring and support for physical recovery process, including pain management, wound care if applicable, if the patient undergoes episiotomy, and the postpartum bleeding. We have breastfeeding support, lactation consulting to address the breastfeeding challenges, promote a successful breastfeeding and discuss the alternatives needed, mental health, screening for addressing postpartum depression and anxiety, providing emotional support and referrals to mental health services as needed. For family planning, including on contraceptions, option and timing for future pregnancies. And lastly, the general's women's health, the reproductive health services related to promote successful breastfeeding and discuss alternatives if needed, the bone health assessment for management of bone health to prevent osteoporosis, particularly in menopausal women. And lastly, our menopause management, support and treatment options for symptoms associated with menopause.
So, for the challenges and aspects and concepts, access to care, ensuring all women have access to comprehensive health services regardless of socioeconomic status, geographic location, or insurance coverage. Um, we must also have the cultural competency, providing care that is full or respectful of and sensitive to the culture, religious, and personal values of women. Health disparities, addressing disparities in health outcomes among women, particularly those from marginalized communities. Women's health and maternity care require a coordinated approach across various healthcare providers and support systems to address the comprehensive needs of women at different stages of their reproductive lives. By focusing on prevention, personalized care, and addressing specific health concerns, healthcare system can improve health outcomes for women and their families. Next slide, please.
Then, the next is the reproductive health services and education. Next slide, please. So, reproductive health services and education are essential components of comprehensive healthcare, aiming to support individuals and couples in making informed decisions about their reproductive lives, ensuring access to information and care to promote the optimal health outcomes. These services are critical for addressing wide range of reproductive health issues, including family planning, sexual health, and maternal health. Here's the detailed overview of their key aspects. Next slide, please. So first is the reproductive health services. So family planning and contraceptions provides access to a variety of contraceptive method to prevent unintended pregnancies, counseling to help individuals and couples choose the best contraception method based on their health, lifestyle, and family planning goals. Then second is the transmitted infection or STI preventions and treatment. So this is to help screening, preventions, and management of STIs, including HIV, education on sexual practices, and the importance of regular screenings. Then the third is the fertility services, assistance for individuals and couples facing challenges in conceiving, including access to fertility treatment like IVF or in vitro fertilization, counseling and support for those dealing with infertility or underlying fertility treatment. Next slide, please. For fourth is the pregnancy and maternity care. Prenatal care or prenatal care to monitor the health of the mother and developing fetus, identify any complication, and provide guidance and healthy pregnancy. Postnatal care to support the physical and mental health of newborn mother. Then five is gynecological services. Regular checkups for the early detections and treatment of gynecology conditions such as endometriosis, polycystic ovary syndrome or PCOS, and cervical dysplasia, pap smear, and HPV vaccination to prevent cervical cancer. For six is menstrual health management and treatment of menstrual disorders such as dysmenorrhea or the pain periods, um, minor minorgia, heavy menstrual bleeding, and amenorrhea, the absence of menstruation. Then education on menstrual health and hygiene. Next slide, please. Then lastly is the menopause management. Support and treatment option for managing the symptoms associated with menopause. Counseling on bone health, cardiovascular health, and sexual well-being during the postmenopausal years. Next slide, please.
So we're going to proceed to the reproductive health education first. Comprehensive sex education program that provide age appropriate, scientifically accurate information on human development, relationships, personal skills, sexual behaviors, and health services. Aim to empower young people to make informed decisions and adopt healthy behaviors. Second, public awareness campaigns. Initiative to increase public knowledge on reproductive health issues, such as importance of regular ST screenings, contraceptive options, and maternal health care. Utilize various platforms, including social media, community workshops, and school-based programs. Three is counseling services. One-on-one or group counseling session to discuss reproductive health concerns, including contraception, pregnancy, STI prevention, and relationship issues, and provide confidential space for individuals to seek advices and supports. Next slide, please.
So moving on, this part is about family planning and contraception. So family planning and contraception are integral components of reproductive health, offering individuals and couples the ability to decide if and when to have children and how many children to have. This control plays a crucial role in improving the health and well being of women, families, and communities. Effective family planning can lead to healthier pregnancies and births, support women's health and education, and contribute to economic growth. So, what are the benefits of family planning and contraception? So, we have here first, healthier pregnancies and births. So, timing and spacing pregnancies reduce the risk of preterm births, low birth weight, and maternal and child mortality. Second, we have for the empowerment. So, it enables individuals, especially women, to make informed choices about their reproductive health, pursue education, and participate more fully in society. Third is for economic benefits. It reduces healthcare costs by lowering the number of unintended pregnancies and improves the economic stability of families. Lastly, we have reduced abortion rates. So, this access to effective contraception can decrease the number of unintended pregnancies and consequently the number of abortions. Next slide, please. So, we have here the methods of contraception. Number one is the barrier methods, which prevent sperm from reaching the egg cell. So, examples are condoms and diaphragms. Second is hormonal methods. So, these regulate hormones to prevent ovulation. For examples are oral contraceptives, contraceptive patches, vaginal rings, and injections and implants. Number three example is we have intrauterine devices or IUDs. So this is a T-shaped device inserted into the uterus available as hormonal or copper, which is the non-hormonal. Next slide, please. So we have also here natural methods. These involve tracking fertility and avoid intercourse during fertile periods. For example, fertility awareness methods or withdrawal methods. So one example here also is the calendar method. Number five, you have permanent methods. So these include surgical procedures that provide permanent contraception. For example, tubal ligation for women and vasectomy for men. Next is we have number six, the emergency contraception. It prevents pregnancies after unprotected sex or contraceptive. Next slide, please. We also have family planning services. So what do they provide? They provide number one, education and counseling. So information on different contraception methods, helping individuals choose the most suitable one. So the continuation will be explained by Miss Caitlin Sevilla.
So for the family planning services, first is the education and counseling, information on different contraception methods, helping individuals choose the most suitable one. So in here, they provide information on various birth control methods to help people choose the best one for them. So second is the health screening, routine checkups and screening for reproductive health issues. In here, they offer regular checkups and tests for reproductive health. In the third one, management of contraception side effects, assistance in managing any side effects and switching methods if necessary. In here, they help manage any side effect from birth control and suggest alternatives if needed. Fourth, preconception counseling, guidance for those planning to become pregnant, focusing on health and lifestyle adjustments to promote a healthy pregnancy. In here, they give advice to those planning to have a baby, focus on health and lifestyle changes for a healthy pregnancy. Next slide, please. For the challenges and consideration, first is assess. So we have geographic, economic, and cultural barriers can limit access to family planning, resources, and education. This explains how, as some people face barriers like location, money, and cultural beliefs that make it hard to get family planning services. Next, For the second one, contraception myths and misconceptions. Misinformation can lead to underused or misuse of contraception methods. In here, wrong information can cause people to use birth control incorrectly or not at all. Last, policy and fundings. Challenges in political climate and funding can impact the availability of family planning services. In here, political changes and funding issues can affect the availability of family planning services. Next.
So, for the prenatal and postnatal care, which means this is critical components of maternal and child health services focusing on the health and well-being of the mother and the baby during pregnancy, childbirth, and the postpartum period. These services aim to ensure safe pregnancy and delivery and promote healthy outcomes and provide support and education to new mothers. Prenatal care involves regular checkups and comprehensive support throughout the pregnancy. Its primary objectives are to monitor the health of the mother and the developing fetus, identify and manage pregnancy related complications, and prepare the mother for childbirth. Next is the postnatal care or post or postpartum. It cares focuses on recovery from childbirth, adjusting to life with the newborn, and addressing any health concerns for the mother and the baby. This period is crucial for ensuring the health and well-being of both mother and the child. Id, ikat ng to heart ha. Sige. 1, 2, 3. So proceed. Here are the key components of the prenatal care. First, the initial assessment, comprehensive medical history review, including previous pregnancies, family history, and any potential risk factors. And physical examination, including the pelvic exam and baseline laboratory test, the blood work, the urine analysis, and STI screening. Next is the ongoing monitoring. Regular assessments of fetal development and maternal health through physical exams and ultrasounds, and monitor maternal weight gain, blood pressure, and any symptoms that may indicate health concerns. We also have here the nutrition and lifestyle counseling, guidance on healthy eating, prenatal vitamins, and avoiding harmful substances like alcohol, tobacco, and certain medicines. Recommendations on physical activity and managing common pregnancy discomforts. Next is education and support. Information on what to extend during pregnancy, labor, and delivery. Resources on breastfeeding, newborn care, and parenting, parenting skills. And also, we have here the risk management, identifying and managing the high risk pregnancy like gestational diabetes and preeclampsia through specialized care and interventions. Lastly, we have here the preparation for childbirth, discussion on birth plans, pain management options, and what to expect during labor and delivery, classes on childbirth, breastfeeding, and newborn care. So proceed. Next, for the key components of the postnatal care, number one is health monitoring. We have to we have to do the regular checkups for the pregnancy to monitor the physical recovery of the mother, including the healing from the childbirth injuries and adjusting hormone levels, screening for the postpartum depression and other mental health concerns. Next is breastfeeding support, assistance with breastfeeding techniques, addressing challenges, and ensuring the baby is feeding well. And next is the nutritional guidance for the breastfeeding mothers. The newborn care guidance on newborn care practices, including bathing, diapering, and sleep safety, and screening and vaccinations for the baby. Next, we have here family planning, counseling on contraception options and timing for future pregnancies, and lifestyle adjustment support for physical recovery, including advice on postpartum exercise and activity levels, and education on adjusting to the emotional and practical aspects of caring for a new.
So for the health issues specific to women, women's health includes unique and significant concerns such as reproductive health issues, pregnancy complications, and conditions related to menopause. These challenges affect women's physical, emotional, and social well-being across all stages of life. Addressing these issues through education, access to care, and research ensures better health outcomes and empowers women to live healthier lives. So we have these different health issues. So next slide, please. So for the reproductive health issues, we have these menstrual disorders. So these menstrual disorders include various conditions that disrupt normal menstruation, just like, for example, dysmenorrhea, a painful cramps, menorrhagia, excessive bleeding, and amenorrhea or absence of menstruation. So this condition can significantly affect a woman's quality of life, productivity, and mental health. Understanding and addressing these issues ensure better management of well-being. So, for example, a young woman experiencing severe dysmenorrhea may miss school or work regularly, leading to poor academic or professional performance. Next is for the polycystic ovary syndrome or the PCOS. So, this hormonal imbalance affecting women of reproductive age. Symptoms include irregular periods, excessive hair roots, and potential infertility. So early detection and management can reduce risk of complications like type 2 diabetes and cardiovascular disease. So for example, a woman with PCOS might require lifestyle modification and medication to regulate her menstrual cycle and manage insulin resistance. So next is for the endometriosis. So a condition where endometrial tissue grows outside the uterus, causing severe pain and fertility problems. So endometriosis often goes undiagnosed, leading to prolonged suffering and complications like infertility. So, for example, a woman experiencing chronic pelvic pain and difficulty conceiving may benefit from laparoscopic surgery for diagnosis and treatment. Then lastly is the fibroids. So uterine fibroids are non-cancerous growths that can cause heavy bleeding, pelvic pain, and fertility issues. So timely management of fibroids improves reproductive health and prevents anemia due to heavy bleeding. So for example, a woman with large fibroids causing recurrent miscarriage may undergo surgical removal to improve her chances of pregnancy. So next slide, please. So the pregnancy-related issues. So first is the gestational diabetes. So this condition affects the blood sugar levels during pregnancy, posing risk to both the mother and the baby. So early diagnosis and management prevent complications like preterm birth, large birth weight, and long-term diabetes. So for example, a woman pregnant with gestational diabetes may require dietary changes and insulin therapy to maintain normal blood sugar levels. So for next is the preeclampsia and the eclampsia. So Preeclampsia includes high blood pressure and organ damage during pregnancy, while eclampsia includes seizures. So these conditions are life-threatening for both the mother and the baby and require prompt medical intervention. So for example, a pregnant woman with high blood pressure and protein in her urine might be hospitalized to prevent seizures. So next is the postpartum depression, a serious mood disorder occurring after childbirth that impacts a mother's ability to bond with her baby. So early recognition and treatment ensure better outcomes for both mother and the child. So for example, a new mother feeling hopeless and detached from her baby may benefit from therapy and support groups. So next slide. So the gynecological health. So for number one, the cervical cancer. So a preventable cancer caused by HPV infection. So detected early through pap smears and HPV vaccination. So regular screening saves life by identifying precancerous stages. So for example, a woman undergoing annual pap smears can detect and treat abnormalities early, preventing progression to cancer. The next is the breast cancer, the most common cancer in women, often detected through mammograms or self-examination. So for example, a woman notices a lump during a self-exam and seeks medical attention, leading to early stage cancer treatment. And lastly, the ovarian cancer, often diagnosed late due to subtle symptoms like bloating and pelvic pain. So, for example, a woman reporting persistent bloating and fatigue undergoes an ultrasound, leading to early detection of ovarian cancer. Next slide. The sexually transmitted infection or the STIs. So women are biologically more susceptible to STIs, which can lead to infertility and chronic pain if untreated. So education and preventive measures such as condoms, use of vaccination reduces STI incidence and complications. So for example, a young woman receives the HPV vaccine to protect against cervical cancer. Next slide, please. The menopause related issues. So first is the osteoporosis. So these postmenopausal women face higher risk of bone loss and fractures due to declining estrogen. So preventive measures such as calcium and vitamin D supplementation maintain both bone health. So for example, a woman starts training and takes supplements to reduce her risk of osteoporosis. Then next is for the cardiovascular disease. So risk increases after menopause due to hormonal changes, weight gain, and lifestyle factors. So a postmenopausal woman maintains a heart healthy diet and exercises regularly to reduce cardiovascular risk for the example of this cardiovascular disease prevention. Then next slide, please. So the mental health. Women face higher rates of depression and anxiety, influenced by social roles, hormonal changes, and caregiving burdens. So addressing mental health promotes overall well-being and prevents long-term consequences. So for example, a mother feeling overwhelmed by caregiving responsibilities seeks counseling and joins a support group as a coping or one of the example for the coping mechanism for the mental health. Then next slide. So addressing women's health issues. So number one, educate and provide awareness. So empowering women with knowledge about their health fosters informed decision making. That's why awareness leads to early detection and treatment of health issues. Just like, for example, a workshop teaches young women about menstrual health and self-examination. Then access to care. Ensuring women have access to comprehensive healthcare improves outcome. Accessible care reduces disparities in health outcomes. So just like for example in the RHU, they offer free cervical cancer screenings and prenatal care as well as for the postnatal care as we have our duty in the RHU. Then lastly is for the research and advocacy. So advancing research and promote policies improves women's health services. So these focused efforts addresses gaps in knowledge and healthcare access. So just like for example, advocates push for funding to research treatments for endometriosis or other related or diseases. And that's all. Thank you very much.
So much for